it was a hard year. We all learned a lot about COVID-19, if we wanted or not. It was infecting all our life. In fact, influencing all our life. It was infecting a lot of people. And it is a pandemic which probably now will not anymore, will go to endemic, and we will have probably to live with it, probably not. There was a lot of research. So I would like the additional speakers just to present themselves for a moment. Can we start with Dr. Thorne Lobe?
Great. I'm Dr. Tom Lobe. I am a professor of surgery at the University of Illinois in Chicago, and also an expert in regenerative medicine. And I've been involved in the management of patients and testing for COVID since the pandemic began at its earliest time a couple of years ago now.
Thank you very much. The next speaker is, sorry. Leonardis, sorry, I have problems with the last name, which is Reptakis. Sorry, the last name, I apologize, sir. The last name was cut off the paper, which I just got handed. So
all you have to say it's Greek. Well, you got to say it's Greek to me. That's all. My name's Leonidas Reptakis. I'm a Rhode Island state senator. Been elected for about 25 years in the state of Rhode Island. And again, we've been affected very much with COVID-19 like the rest of the country and the rest of the world.
Thank you very much. So when, sorry, my co-host.
Hi, everyone. I will be here just to basically co-host. I used to work for the Human Health Organization closely with Dr. Tom Lobe. We did a lot of administrative work to get tests and masks and essentially at the end vaccines to end users, specifically productions, and help them organize the day-to-day, which means we saw this working and not working logistically plenty of times.
Thank you very much. So let's start with the current picture of COVID. We see a rise in, of course, infection, record numbers of people which test positive right now. Death toll, thanks God, not so much. And we hear a lot about that probably because of the Omicron, we would be now close to become herd immune. So I would like to have there some opinions on from our medical professional.
Sure, I'll go ahead and start if I may. I think that we're lucky in that this current part of the pandemic, the current spikes are with the Omicron, which seems to be a less severe infection. But what we're seeing is that people who have had COVID before and who have had vaccines and had boosters are becoming infected with this new strain. It's genetically quite different than the Delta and the strains that preceded it. And the problem is, while this is currently the overwhelming variant that's infecting the world, although the time sequence is different from state to state of the United States and from country to country around the world, we don't know what's coming next. And the virus is a bit unpredictable. So while we believe that we may be approaching herd immunity, that's up for grabs. That may or may not be true. I mean, more and more people are becoming infected. But because it's apparent that even the vaccine, while it may protect you from getting very, very sick, is not keeping you from getting the disease, it may be that the next strain that comes along is even more problematic. And we just don't know at this point. It's really, we don't have enough data to be able to tell. I know there's a new variant coming that's called Deltacron. It's kind of a genetic mixture between Delta and Omicron, and has some of the features of both. There's no other prominent vaccine on the immediate horizon, but I suspect that as soon as Omicron dies off, we may, in fact, see another new variant sweep around the world.
Do you have any data of the cross immunity which can be provided from the two diseases, from Delta variants to Omicron? Is it 20% cross immunity, or how is cross immunity protecting?
Yeah, the problem is, the real answer is no, not precisely. We're only taking educated guesses and watching the behavior of these variants as they come along. It seems like if you've had Delta, you can get Omicron. If you've had Omicron, you can get Omicron again. And so it's not even necessarily protective once you've caught it and been over it. And so it's unknown what the next variant will bring, because we just don't know what its mutations are going to look like.
I have a question and we have a senator on the panel, and of course, this was a really big hit for your state. What are you doing currently? Are you suggesting boosters, and how many boosters you think is feasible? Probably first, Doctor, could you explain about the boosters, and then probably we go to the senator to explain how what he sees implemented right now in his state.
Sure. Well, I guess the leader in the fourth booster has been Israel, and they've instituted a fourth booster program to try and protect their nation. We think that it's important to have had the first 2 doses of the vaccine, and that protects you for maybe 3 or 4 months, after which some of the immunity dies off, and we think the booster brings it up to a much higher level of protection. But again, we don't know exactly how long that's going to be. What we do know is that it's actually helpful. It seems to be helpful to get different vaccines for a booster. You seem to actually have better protection. Say if you've had Pfizer, if you get Moderna as a booster, then or the other way around, if you necessarily stick with the same series. But it's really unknown how long this booster protection is going to last. My guess is, having watched the COVID virus now for as long as it's been around, is that we're going to need boosters on a regular basis. Whether they be annual or twice a year is yet to be determined.
Thank you, Rob. Senator, Senator, I apologize totally. What is your state doing right now to provide access to all the booster shots, and how many percentage from your state are actually getting boosted? Is there, and what do you think is the problem for getting more population boosted?
Was this for the senator?
I'm sorry, that question was for me?
Yes, the question was for you.
Well, basically, Rhode Island's taken the lead as far as being vaccinated. We've had a good majority of the population that's already received both vaccinations and the booster. And I think we rank probably one of the highest percentage in the country. Now what we're targeting 5 to 12-year-olds. So that's something that we're trying to get into the elementary schools, because that's where we've had a problem. And a lot of the Omicron virus has spread within the schools. So that's our big problem, is not the adults, but trying to target the younger children to prevent them from getting sick. So that's where our dilemma is right now. So as far as vaccination, both vaccinations and the booster, and then some people have already had the flu shot. So they've probably had 4 shots if you want to technically add the flu shot, but mostly we're looking at the the younger children from 5 to 12. That's our target right now in Rhode Island.
Thank you very much. So, I mean, your state did a lot of efforts, but we heard just before from a medical professional that the boosters may not help against the Omicron virus. So back to the medicine, does it make sense to immunize children right now? Would you recommend it personally? Or, I mean, there's a lot of controversy, which some misinformation is on the internet, and if we could clear this misinformation from the internet up for our audience would be really great.
Sure. So I think that the vaccines and the boosters protect people from dying. So that's and getting very ill. That is their main purpose. They do not and never were designed to keep the disease from spreading from one person to another. So they don't change infectivity, although it stands to reason if you don't have a huge viral load or you're not as sick enough to get in the hospital, that you might be less likely to spread the disease. But the vaccines really weren't designed to prevent catching the vaccine, catching the virus. They are designed to prevent death. And to that end, one of our biggest populations in the United States in the hospitals are kids. Our children's wards all over the United States are full of very sick children with respiratory disease because of the COVID, because they haven't been vaccinated. So I think it's important to get these kids from the 5 to 12 vaccinated and boosted. Our problem age is the under 5 years of age. You know, we don't yet have an approved vaccine for emergency use or otherwise that appears to be safe for these young kids. My own daughter has 2 kids under 5, and she's sort of frantic. What am I supposed to do? Do I send them to school? Do I have them around friends? And of course, these days it's really impossible to keep your little kids away from getting exposed. And so, you know, we hope our hospitals just have room for as many sick people as we have.
Senator, what is your concrete plan, what you intend to recommend the public school system to do right now? And I know that boosting is important, but what is a concrete measurement which is right now on the way to get the children vaccinated?
The problem we have, going back to the question, is we also have a political issue where we have teachers not wanting to go to school because of the fear of getting COVID-19 from either children or from other sources. So we really the problem is we got a stressful situation here. That's the big issue. So then it's up to the governor to make a decision. We just had the health director that just resigned over issues of masking. Do we have children being masked at school? Do we have children do virtual, not going to school? So there's a lot of problems we have on top of the question whether we go forward and boost the children. So we've got about 4 or 5 different issues. And the problem is we have the political division. Like I said, we have the social distancing recommendations. What do? Do you social distance, not being with the children? There's a lot going on. So my personal opinion is I think we should try to get as many vaccinations into the arms, and hopefully that prevents a profound effect of hospitalization, like the previous speaker had said. But in that mix, you have divisions, unions versus parents, whether to go to school, not to go to school, have, again, classes at home, like we did at the beginning of the pandemic. So there's a whole mix, and what the answer is, who knows? I would say we just be very cautious how we proceed forward. But my recommendation is try to get as many vaccinated. that would probably hopefully help with the situation until we can really control the outcome. I mean, the future is very, very concerning. And I would say all the way up to the President of the United States, whether they have the ability, whether this president or future president, we don't know how long this pandemic's going to last. That's another question. So it's kind of very frustrating and very, very stressful what's happening right now.
Yeah,
We have a person from the HWO, also Thomas here online. Thomas, could you please comment on what was discussed right now? Do you have there any opinions?
Yes, thank you, Carl. Although I'm not representing today here WHO, but indeed I work there. So let me just give you my personal take on it. I feel that the pandemic is showing us the big inequalities in healthcare and education globally. I mean, that's for me one of the main concerns. But at the same time, I do hope that but this global crisis will also result at the end in better institutional arrangements in tackling future pandemics. And you probably heard that the WHO is setting up right now in Germany a pandemic preparedness office that will has been tasked to provide early warning for future pandemics. But of course, this new office will only be as efficient as the data shared by member states with this office, and that was also the problem in the past. So I hope that really, our member states will be more transparent and will provide better data in the future, so that we can maybe tackle future pandemic earlier. When it comes to predictions, many people predicted, something might happen, something similar to COVID. Bill Gates, remember, after Ebola, had a famous TED talk. But also, if you go further back, the CIA published a report, I think 2009, where they exactly predicted that it would be a pandemic that will be airborne and probably come from markets in China and Southeast Asia. So there's no lack of predictions, and I'm sure that will be the case in the future. But we need to listen more. And I think if we want to have a world in a better shape in the future, we should look into a more cooperative model rather than a competitive model. And I hope that's what we're doing.
I have a bit of a general question. Sorry, that happens with the back and forth because we sit in the same room. What we've seen on the logistical side is a big problem are dealing with unions and what unions allow on a regulatory basis. So we have this here in LA with SAG and IATSE in the very beginning. They've allowed a very specific test as the only test to be opening up specific productions, which was later then allowed into other working unions, such as the Teamster Union and others all around the country. What are your thoughts on enough research and helping the unions find the right tests to allow, and not just one, not to monopolize one over the other? What's the information available to unions and how is that being handled?
I'm sorry,